We're segueing straight into the panel discussion. Unfortunately, Pat Kinney was unable to join us today, but we do have someone who joined us today, Stephane Hallegatte, who will take a few minutes to provide his perspective on what he knows and what he's heard so far. He was unfortunately unable to be here yesterday. And then we'll have a series of questions which are a secret to you because they're right behind your head, but I will read them to you. Oh, they're down in front. Oh, good. So you're on the program. So which program who all is supposed to be on the panel?
The entire group.
The entire group.
So we are listed on there.
Active. Fantastic. So we now have, come join the panel, please. I obviously have an old program. But Stéphane, if you would take a few minutes, that would be great.
Yeah, I did not ask the question because then I thought I would have nothing to say during the panel, so it would have been an issue. So I kept everything for me, but I had a few reactions to the two talks that are very much linked to some of the work we're doing right now at the World Bank, looking at the interactions between climate change and poverty. And clearly, when you're looking at climate change and poverty, the question of health is one of the big issues. And the first question, and Tony, you touched on it, is really how can we make sure we're looking at health as an outcome, and it's clearly a very important outcome, but also as a channel through which a lot of the impacts will affect everything else. And if you look at numbers on why people who got out of poverty sometimes fall back, you find that depending on the cases, between like 50 and 80% of the cases, this is linked to some health-related problems. So we have these people getting out of poverty, accumulating assets, getting better, and a lot are falling back because of health issues. So there is this question of health outcome, but if you increase even by, 10%, the number of people who every year will fall back into poverty because of health impacts, you can have a huge impact on the dynamics of poverty worldwide. And the numbers, if you accumulate over time, might be extremely big. And then you get into this complexity of the simplest figure, which is already complicated. If you do that, you have like this feedback between poverty and the fact that people cannot protect themselves against health and so on. And one of the questions I came with at this workshop, unfortunately only the second day, is all the discussion on universal healthcare. Because if you look at why people fall into poverty, there is one thing which is linked to the disease itself, and one part which is linked to expenditures, like health expenditure that people have to pay. And I was really wondering if we can say something about whether universal health insurance is something that is a critical adaptation tool for climate change. And in this discussion about social protection, maybe this is the big question, and maybe more than the impact of climate change on the health itself, that's the question of how we react to that, which is really important to me. The second question you also discussed is we're having this target of eradicating extreme poverty by 2030, eradicating in the sense having less than 3% of the global world population in extreme poverty. One of the questions is doing that something that can change everything about the health impact we're talking about? Is bringing people out of poverty in a way like sufficient to avoid a lot of the issues we have been talking about? Or do you need to do this differently because there is climate change and because some of these emerging risks might materialize at a point? And a side question is, when we try to ask for resources to eradicate extreme poverty, can we also make the case that we would avoid a lot of climate change impact if we were able to eradicate extreme poverty by 2030? And if we delay this, then we'll have to eradicate extreme poverty as a lot of the impacts start to materialize. So maybe it's easier in a way to eradicate extreme poverty now because impacts are emerging but still limited. And if we wait too much, then we will create these poverty traps. That might be an issue. And finally, my third point is also a reaction to what you showed, and also to the IPCC synthesis report published yesterday. A lot of the interest these days is about things we see already. So we have this point, which is really important. We're not talking about impacts in the future, but we see a lot of impacts today happening now. And because it's in a way easier to work on things that are happening, and we have data, and we can, I mean, it's solid ground. I really feel that a lot of people are starting to work on that. And one of the questions I have is, if you're thinking about mitigation and the target in terms of climate change we have, maybe everything depends on what happens in 2100 and beyond. And I really feel that there is a move of the entire community looking at the short term, because we have this data, and in a way it's easier, and maybe not looking so much at the 2100 and beyond. And for me, one of the conclusions of the synthesis report, which is really important, is if you want to keep the temperature at a certain level, it means that over the long term you need to achieve zero CO2 emission. And this would drive then everything else in terms of policies, if you agree that the end goal is zero emission of CO2. But this end goal is justified only if you look at the very long term. So even though it's difficult, as you said, I really think that we should really fight against this move toward the short term only, and to keep some of the research over the long term. I mean, in our work on climate change and poverty, everybody around is saying, oh, if you want to get some interest from policy and decision makers, you need to really focus on between now and 2030. And we're really trying to fight hard to say that there are some messages for the 2080s and even beyond that matters for today's decisions. And this is something that really we should, I mean, it's, if not the research community, nobody else will push for taking into account the very long term, because nobody really wants to, because it's just a huge bunch of problems that people would prefer not to talk about. So I really think that this is important. It's our role to just keep alive this discussion about the impacts of the long term. And I was thinking about the maps with the dengue and so on moving around, and it would be really interesting to see what it means for like 5-6 degrees of warming. Right. Because then it gets you the cap that you need to justify the zero emission over the long term. So that were my 3 main reactions. Thanks.
As always, those are really excellent. And I really want to strongly support the point on detection and attribution. It seems like the scientific community is still of the mindset that we need to justify that climate is changing. And at some level, it's almost like in the Middle Ages of how many angels dance on the head of a pin. It's a very complicated set of questions. It is very difficult to parse out. And if the purpose is only to move policy, we should keep that in context of what the broader term goals are, which is understanding what we need to do about adaptation and mitigation. Anyway. Anybody else have any other reactions before we start with our 3 questions?
I've got a few comments, because this is around the integrated assessment models, which are a particular branch of research where they try and model across all the sectors, but they also put in the mitigation costs. So these integrated assessment models, they're very good at sort of quantifying impacts on GDP, but they're not so good on the non-market impacts. And if you kind of look at the health modeling's fairly limited, and it's all monetized anyway, so they're not that interested in people, right? And they're not interested in the other non-market impacts. So there's clearly a big gap there to how to improve that sort of modelling sphere, because it's not just people, there's environments, there's all the other things we value that don't have a dollar sign attached to them. But what integrated assessment models are very good for is the cost of mitigation. And at the moment, they don't put in the co-benefit. Mm-hmm. So I think the most obvious thing that these integrated assessment models should do, and I don't think Michelle's still here, is she? So what she was saying about all these huge health benefits from reducing carbon emissions in terms of air pollution and air quality, we're pretty good on those. And if all those health benefits were put into the integrated assessment modelling, then you suddenly reduce the cost of mitigating quite dramatically. And then there's a whole range around nutrition, methane, low fat, reducing animal fat, active transport. There's a lot of work going on, certainly in Europe, around these health co-benefits. So that would be one obvious improvement to the integrated assessment modelling. Also, I just wanted to agree with what Stéphane said about we have to be a bit careful about how we model health as an outcome. So health will be affected, but we know, and there was a recent paper on this, that in terms of demographic change, you have to kill huge amounts of people to have sort of noticeable effects. So that's really not what we're aiming for. You know, climate change in terms of mortality is just not going to kill enough people to make sort of dramatic changes to emissions, for example. But what it will do is will undermine development. So it will undermine a lot of the current development strategies, you know, undermine achieving the Millennium Development Goals or the new Sustainable Development Goals, and also undermine some specific global health strategies that we are now relying upon to improve health. So I think that should be a focus of future work. Okay.
One point on it, because if these impacts have an impact on population, if you just look at some of the households coping solutions, which is taking kids out of school, for instance, and I mean, if you reduce poverty eradication and education, you would get more people actually in the end. Mm-hmm. I think the impact through development on population would be much larger than the direct impact through mortality or anything else. Exactly. So it's even making, on the emission side, maybe the problem worse.
Yeah.
Just a few comments. So we were trying to take a step back and trying to assess this kind of issue from a systems perspective when it comes to integrated climate change modeling. And we conducted a thought experiment where we're trying to identify the different sectors and the different drivers of infectious disease events that could potentially overrun the European public health infrastructure. We're looking for events that are unanticipated, like the SARS epidemic or pandemic, avian flu, the kind of events that we didn't anticipate. And we asked ourselves, what are those drivers that we need to consider in order to try to anticipate what can happen? And what you can see on the slide up here on your left is the plausible scenario that we developed as a thought experiment, where we came up with 3 classes of drivers: globalization and environmental change, and then social and demographic change, and public health system change. So these are 3 big categories of drivers that could potentially have an impact on infectious disease events in Europe. And then we developed these type of scenarios that could happen as a result. So this was designed for 2020. It was a thought experiment that was done with experts and literature review and so on. The next step then was to, instead of taking this prospective approach, to take a retrospective approach by relying on a database that was developed at ECDC for epidemic intelligence. All these events that happened worldwide that are captured in our epidemic intelligence that we conduct on a daily basis. And we basically evaluated all these events that happened in Europe particularly, and identified the drivers that caused these threat events, infectious disease threat events. And that's what you can see here on your right. So now you can see what the experts had predicted in a foresight study compared to what actually happened in reality 5 years, looking back in 5 years. And you can see that the situation is much more complicated than we had anticipated. You can see that there are many more drivers that we had to add to the list, and many more connections that lead to certain events that did in fact happen over that 5-year time span. And so now when it comes to your modeling, the type of work you do, how do we factor in all these different factors into our equations in order to come up with predictive models that can help us with early forecasting and predictions and so on, if it's short-term or long-term? So whatever the question you are asking, you need to decide whether there's a short-term prediction or long-term predictions, and depending on that, these are the kind of drivers that you need to feed into your system. And it is very complicated and complex, as you can see based on this slide. And one approach that Chris and some colleagues had taken was to try to develop a vulnerability map for Europe, where these kind of infectious disease events can happen in relationship to climate change. And so here we defined vulnerability as impact over adaptive capacity. That's a paper that we published maybe a couple of years ago or a year ago. And here we relied on data that was developed by European ESON study that looked at different types of dimension, awareness, ability, and action to define the adaptive capacity within a European society. So it was a Delphi study where they tried to analyze the adaptive capacity within regions within Europe, and we used that to identify the vulnerability for infectious diseases from climate change. And so that's we then can feed in these type of drivers into this kind of a model in order to see where those impacts will be in the long run. So this is just an example of where this field could go forward by identifying the different drivers that are important for these kind of events that will come into play. Climate change, as you can see, is one of them, but it's not the only one.
Right.
Did you want to add anything, Tony? Before
So,
we go to
I mean, I think these are excellent comments. The need to appreciate the complexity of these systems, depending on the task at hand, and the need to think about changes in the climate system in an appropriate context, along with all the other drivers of health outcomes. It would be relatively straightforward to think about a world in which many other factors are in fact far more important in determining health outcomes than change and variability in the climate system, which may have the capacity to influence one or a few of them in particularly important ways, but obviously not all of them. I direct a center for the study of the longer range future, so I could hardly disagree with Stéphane's point about not only studying today's world, but thinking about the longer term. And I think that's actually really important, because I think one of the things that has happened continues to happen in the public debate about issues like climate change, which are themselves enormously complex and have both short-term and long-term consequences, is that I think there's a systematic underestimation of how big a problem this really is. It's not like it's news to the research community that if you're trying to stabilize atmospheric concentrations of greenhouse gases, that emissions have to go to zero. That's kind of how, if you want the level of water in the bathtub to stay where it is, you have to turn the faucet off. Or at least the faucet cannot be running any faster than the leak in the drain, which is the equivalent of ocean uptake of CO2. And so we've known this for a long time. But the magnitude of that task, I think, sometimes is viewed as being so overwhelming, and the options for achieving it so difficult to grasp in many cases, that it's hard for a whole variety of policy communities to deal with, and so they focus on the shorter term, on things that one could actually do. My own experience is that we in turn underestimate policymakers if we actually believe that they only care about the next election. That's actually not true for many of the people that I talk to and have talked to over the years on both local scales and national scales and internationally, that there is a concern for the long-term sustainability of systems. They may not care particularly on what drives those systems, depending on what their responsibility is. We're doing a major conference in a week and a half on sea level rise in coastal cities. And at some level, the mayors of the cities who will participate, it's nice for them to understand why we have sea level rise the way we do, and why it's locally varying, and what different scenarios of change might be. But their job is actually protecting the seacoast, protecting the investment in local areas, protecting homes and livelihoods. They don't actually need to understand all of the scientific details of why that system works the way it does. Their job is to protect lives, livelihoods, and property. And they absolutely have a long-term view of what they're trying to do. So we, in our turn, in our thinking, should not underestimate the ability of some of these policy communities to think to have a real long-term view of what's important.
I'll add one comment before we go to the question. Another part of what you're saying is, or I think an addition to what you're saying, Tony, is there is a lot of discussion of 2100 is just so far away. But anyone who's young enough to have young children, and some of the people on the panel are young enough to have young children, anybody who's old enough to have grandchildren, life expectancy in most of the developing world is around 85. Those children will be alive in 2100. It is not that far away. And I think we need to help move understanding that that temporal scale is short. And we are facing already, those of us who've been working in this field a long time are facing impacts we thought would not occur in our lifetimes, or if they did, it wouldn't be until much later in our lifetimes. And we're already seeing impacts that were originally projected at 2050. And children and grandchildren born now are going to be seeing the consequences of the actions that are taken. So that it isn't a long decision-making timescale, it's really quite short.
Yeah, sadly, 2100 is a lot closer than it was when we started studying this stuff.
Yes. Yeah. Unfortunately, that is very true.
It doesn't get better.
It doesn't kick, yeah, it doesn't
So-
recede into the distance quite as far.
So Tony started something quite a long time ago. Those of us who've been working this a long time know what the CO2 concentration was in the atmosphere when we started working on this problem, and unfortunately that number has changed quite a lot as well. Let's go to the first question. It's about comparability across models in terms of the parameters used and the assumptions made. Anyone would like to make a comment on how we achieve greater comparability? Tony gave a great talk about some of the aspects. Sari?
So one of the things that I would say, Chris, is that, I mean, I think we saw one of the really good efforts to try to do that yesterday in the AGMIT presentation. But it's also important for people to realize that the community of people who are doing either crop productivity models or agricultural sector models or these broader sort of energy economic models, they just started doing this. I mean, they're at the stage of describing the results of these model intercomparison programs, and they've hardly had a chance to sit back and think about it. And so these are, it's really important to do, I think, but it's also hard, and it requires some persistence, and I think a degree of maturity in the modeling communities, that you've got a set of models which are all trying to do similar things. And, you know, if you try to do these model intercomparison studies too soon, you'll get a bunch of results that that you won't understand. So my own sense is you have to have enough experience in the various communities to make it worthwhile.
Shari, and then Jan? Did you say, Shari, you wanted to go?
Just
Yeah.
just to follow up on this one, I totally agree with what you said, and also what Nick Ogden had said earlier about you have to know the system that you're working on in order to make proper predictions of the future. And when it comes to this paper that Chris and some colleagues of ours worked on, we were trying to develop this vulnerability index for infectious diseases from climate change in Europe. We worked on a general vulnerability index for infectious diseases and not a specific one, because we realized that assumptions and underlying parameters for every single infectious disease was so different, so complicated, and so complex that we couldn't find a common, if we were trying to develop these individual models, they were so different that the assumptions were different for every single specific model because they require specific assumptions. So I don't even know if the question is the appropriate question to ask, because we are dealing with highly complex individual situations that require specific assumptions, and they might not be transferable.
I'll come back to slightly disagree with that, because at one level, when we look across the health models, they don't use the same time slices. It doesn't matter what time slices you run. It would be nice if everybody ran the same time slices.
Sure.
And it would be very nice if there was some commonality in terms of you can develop whatever scenarios you want, but could we have a limited set that everybody runs? Because at the end, you can't get any comparability when you're looking across the models if everybody uses different time slices, different scenarios, they use different RCPs, and to actually have the community agree to a limited set and then do whatever else is important to answer the question you have.
Right. So I
But
was
that would
referring
help.
to the parameters within the individual
But the
models.
parameters within,
Yeah,
yeah,
instead
yeah.
of the assumptions. Yeah.
These are the inputs.
Yeah.
Stéphane,
Yeah.
you look like you want to.
Oh, can I? Yeah.
All right, both of you can, yeah.
Well, you know, if someone gave enough investment to bring the modelling groups together, to have a coordinated activity, that everyone agreed on a method, then sure, we could all have consistent baselines and scenarios, but of course that's not how it's happened. A lot of the health modelling's been very ad hoc. Even within that WHO exercise, we had to, where we were relying on the agricultural food trade models, they had a quite slightly different set of assumptions than the health models, and it's just the way that the modelling is done at the moment. And perhaps some thought should be given to how to have a better network among the health modellers themselves. And at least they can coordinate some activities, even if there can't be some very large investment to get everything done at the same time.
Good point. Stephane?
Yeah, I have very mixed feelings about the question because it's useful to have comparability, especially like timescales and so on, makes sense. But I really feel that sometimes, and especially when you get into the socioeconomic issues, trying to get everybody around the same framework is also killing a lot of the kind of like outliers and maybe innovation. And so just to give you two quick examples, in the integrated assessment models, a lot of the models use a baseline GDP growth as an input.
Right.
And for the models who are not taking that as an input, but for which it's endogenous in the model, it has been very difficult to fit in the experiments that were designed to make all that comparable. So for all the models using GDP in baseline as an input, they say, let's all use the same GDP. And the models for which GDP is endogenous, they just cannot take a GDP as an input. So there is a risk of having some of the diversity in models being killed by trying to make all models comparable. Sometimes assumptions means that you cannot compare the models. And we have to be very careful, because if we force all models to go in the same directions, then we're losing what research is about, which is trying new ways. And even from a policy-making perspective, keeping the diversity of approaches is really essential. The second example was within the IPCC, where in the economics discussion in Working Group 2, at one point, some people were saying, we will set like the definition, basically like guidelines for what is a good economic analysis of climate change impacts on adaptation. And what you would see clearly is that was a very quantified approach in which most of the work done in developing countries would simply not fit. And I mean, fortunately, we had like riots in the corridors, and this idea was killed. But you can see that if you have like a dominant framework trying to say this is the way we should compare everything, and you kill some of the information, then you're just losing things. So I would be very careful. I think comparability works for some things, but not for everything, and only when we have a field at a level of maturity, which means that we agreed on the main principles. And then you can, I mean, like comparing climate models, I think is completely okay. I don't think comparing anything close to an economic model is okay, and trying to force people to have comparable assumptions would be a big mistake. Not sure about health, because I don't know the field.
I think we're not going quite that far in health. We're not that mature a community. Really good points.
We have a comment from the web when you're ready.
Oh, okay. Oh, we're taking questions from the web. Why don't we take it now?
So the comment from the web is asking, perhaps getting at some of your points, Stephane, is for the panel to address health disparities. So where we might lose perhaps some of that fine-grained tuning might be in some of the health disparities you see in minority communities that are disproportionately impacted by the impacts of climate change. So the request is, can you comment on that?
Sure.
Yeah, I totally agree. We're not looking enough at how the health impacts. I mean, we're looking very broadly. You know, I showed difference between basically low and middle and high income countries, but a lot of poverty distribution is within country, right. And the whole integrated assessment modelling scenario stuff does not look subnationally. So I think that's a huge area of work, because we know there's lots of poor people in middle income countries now. That's where the poverty is. It's not just all concentrated in the lowest income. And also the intra-urban, so the slum populations that are still growing. And we've just done a report for the International Institute on Environment Development, and there is one health surveillance site in a slum area. basically. So that we just have no health information. It's in Nairobi, but other than that, there's possibly one in Ouagadougou, and there's some data for Dhaka, but that is it. You know, the health of the data is just not there. And until we address those sorts of issues, back to yesterday's comments, we're going to be quite stuck.
So this is also related, Chris, I think, to the second question on your slide about what the primary obstacles are. And I actually don't think this is an issue for integrated, that's particular to integrated assessment models. I think it's just more an issue for integrated analysis that includes health impacts, is that the data are terrible. I mean, it's just the, Sari just described one aspect of it. I mean, you could make a really compelling case that our insistence on framing this issue as an international policy issue, which has sort of forced us to sort of shoehorn ourselves into this national framework, actually gets the primary problem wrong, which is that impacts are much more a function of who is rich and who is poor than which country is rich and which country is poor. I mean, in the U.S., you only have to look at the diaspora from New Orleans. I still just reel at the fact that, and we have a major U.S. city that is now, what, 25% smaller than it was before Katrina. It's never going back, and it wasn't the rich people who moved. I mean, it just wasn't. It was poor people and people of color who were overwhelmingly bore the brunt of that storm, many of whom left. Not all of whom left, but many of whom left. And we understand hardly anything about that in a way that would allow us to then think about the East Coast or coastal cities in South America or Africa or anywhere else. And I think that a big chunk of why including health risk and health outcomes in integrated analyses has been hard to do is this relative paucity of data compared to many other impact domains, and frankly the relative lack and absolute lack of research support that this community has labored under for a very, very long time.
I agree with the points that Tony just made, and just to add another aspect that might play into this also is when we compare the results that were presented from the agricultural community, they are so far advanced compared to where we are, and in the health community, particularly in public health, where we suffer from the fact that successful prevention undermines its own reasons for existence by being successful, right? The more successful we are, the less funding we will get. And that's not a good model to invest into prevention, right? So that's what we're up against. I think there are financial incentives in other sectors, but it's not in ours, right? Because of this dilemma that we're under.
Stéphane?
Just on this aspect, I think if you look at where poverty is in 2030 and beyond, you have a lot of poverty in countries which are relatively rich by today's standards, which means that in a way these countries could take care of this poverty, but will they? We just don't know. And a lot also of poor people in countries, in fragile countries or countries in conflict. That's really the two main groups of people. And for me, it's also two priorities, like really thinking about inequalities within countries and also thinking at fragile countries which just do not have the infrastructure and institutions to just manage these issues. And so I don't know how much we can work on these like fragile and conflict things in links with health. I guess it's even one step more difficult. But I really think that this is also something very important. And to get back to the framing issue, one of the questions I think we're struggling with, and I don't really know how to treat that, is if we're looking at one impact of climate change, in many cases, you can look at this assuming that we're making the right decision in terms of how to adapt to it. And in many cases, if we assume that, the impact is much, much lower than in another assumption set. But if we only communicate on this, we underestimate the problem a lot because, I mean, how often do we make the right decisions? I mean, it's not so often, right? But in the same time, if we assume by design that we're not doing the good thing, I mean, that's also not a very satisfying assumption. But for me, the main issue is the fact that in the literature, you find people doing the two things, looking at basically what happens with perfect adaptation or with more pessimistic assumptions, and sometimes numbers get compared. And people are fighting about things because they think they have different numbers, even though they are just looking at different questions. And so in the comparability question, I think if we could have a good framing for this, we should always look at what you can get if you implement the right adaptation options, but also, I don't know if it's a sort of business as usual with current policies, or if you have projection, assuming that, I mean, you have some invariances in the system, but being able to define, in this spirit of trying to look at the long term, a realistic adaptation scenario, which is not ridiculously optimistic as we find sometimes, or very pessimistic, would be a very good, I think it would really help us communicate our results and to talk with the public and decision makers in a constructive way.
I'm going to broaden this a little bit and then we'll take a question. One of the challenges I see in public health, although we frame much of what we do in terms of prevention, it is a sector that looks historically. We basically wait until there's dead bodies, we count the bodies, we figure out why they died, and then we implement programs. And global change is really pushing the paradigm, not only from the medical model, but also the paradigm of we have information. And it would be a real tragedy if the sector didn't take into account this imperfect information we have on climate change. It is information. It would allow us to be proactive. As Jan said, it is in some sense self-defeating, because if we're really good at using that information, we won't see impacts. Because all the health risks of climate change are health risks today. We could, in theory, prevent everything if we knew how to use this information. In trying to get the people who release the funds, who take the decisions, to move from evidence-based, we are very strongly evidence-based kind of sector, to saying we can use this information even though we know there's a range of uncertainties around it. And we can design different surveillance programs. We can put them in different locations. There's a range of things we could do, and we could avoid what has been projected. And that paradigm is very challenging for the sector, the way it's evolved and the way it views itself. You have a question?
I had two, if it's okay.
Oh, excellent. Two questions sounds perfect.
All right. So first of all, thank you. This has been both thoughtful and thought-provoking. So the first question was inspired by the Niels Bohr.
You're supposed to name yourself.
Oh, George Daston, Procter & Gamble. So the first one was inspired by the Niels Bohr quote. And I was thinking about that, and it's not necessarily as trite as we might think, because prediction is hard, especially about the future. And you can think about predictions not in the future, and I think we've been kind of straitjacketed, at least over the last day and a half, over the fact that the x-axis is always a temporal one out to 2080 or 2100. But, you know, a lot of what we could be doing is predictions based on what we know now, and like your comment about interventions now. So there are experiments that one could think of based on, you know, predictions that we can do now that, in fact, these mayors that you're going to go talk to, you know, would like to do, you know, engineering projects, increase the albedo of one neighborhood over another one. Those kinds of things, you know, would be, you know, tractable and doable now. So what I'm wondering is, you know, how much of the modeling community now is working on problems of prediction that don't have such a long temporal component. And then the second one is completely different question, but it's around something that I haven't heard today, and you know, maybe judging from some of your comments has been already taken off the table. But you know, it's not just a necessary. It's possible to do temperature reversal through geoengineering, which I thought was still on the table, but I haven't heard a lot about people modeling the positive and negative aspects of that, along with everything else that we're doing in terms of health effects.
Good question.
So I'll start, if that's okay.
Go for it.
So the mayors that that we're going to be talking about sea level rise and so on with, literally from around the world at the end of next week, they have to deal with a couple of things. And one is several things that I think are relevant to your question. And one is just the inescapable evidence that they have damage right now. They have vulnerable populations and vulnerable investments that they have to do something to protect. A lot of cities in the U.S. and outside the U.S. have already gone through several generations of climate action plans. In New York and in Boston, those include very strong components of adaptation and preparation. In Massachusetts, both the city and the state have done a whole range of engineering studies on purposeful adaptation to sea level rise and flooding and inundation, because we have a waterfront that floods at astronomical high tide. And it turns out that you don't always have to experience something in order to learn from it, right? So the city government in Boston is painfully aware that had Sandy traveled another few hours north before taking that left turn, it would have washed away most of downtown Boston and not New Jersey and New York. So, you can learn something from near misses. The second thing is that I think most local officials are highly reluctant to experiment on their populations. So enhancing one set of albedo, over another, it might not be they would have to really think about whether or not, whether those are kinds of experiments that they would do. It doesn't mean that they're necessarily off the table. Cities do at a local level. There's always pilot studies. There are always pilot studies before a large-scale intervention is actually introduced. The third thing about geoengineering, there's lots of discussion in the research community about the implications of different geoengineering schemes. I think we understand very little about a world in which, for example, if you're going to do solar radiation management, we understand almost nothing about a world in which we have high levels of greenhouse gases, not much temperature change, but everything else in the physical climate system has been changed because you have forcings, not a temperature response, but what about rainfall? I think that it's, and very few comparable modeling experiments that have actually been done. And so it's I think the policy community will continue to discuss it, but I think that it's right now, in my personal view, is it's rife with all sorts of uncertainties about whether or not it's even a good idea to be thinking about.
Stephane?
Yeah, if I can just add a little bit on the geoengineering piece. First thing, almost all the scenarios that are have warming below 2 degrees that the IPCC assessed have carbon removal from the atmosphere. So it's not geoengineering in the sense of solar irradiance management, but in a way it's already a significant intervention on the functioning of the carbon system. So it would be something like using biofuels that get the CO2 from the atmosphere and to do capture and sequestration of the CO2 emitted by power plants that would be using these biofuels, for instance. And in these scenarios, you get into a world where you have significant positive emissions in many places in the world, but to compensate that, we would do this type of negative emissions using biofuel and sequestration, which means that we would store a lot of carbon in the ground, which in a sense, I think, qualifies also as a sort of geoengineering. The second thing, especially on solar management, is first that one of the risks with that is it's something that you would have to do always. And if you stop for a year or two, then you get what you would get in 100 years of warming in a year or two. Which means that any interruption by a year or two would be a disaster probably of 2 orders of magnitude bigger than climate change we're talking about in normal scenarios. And I think that's something we have to keep in mind. are we really sure we won't be lazy 1 or 2 years in the next million years and not do it? I mean, that's kind of a big bet, I would say. And moreover, to conclude on it, I think this solar management thing is based on a sort of misunderstanding because we're using global temperature as an index. And it's true that by managing solar influx, you can bring this index back to what it is today or pre-industrial. But what really matters is the local climate, including temperature and precipitation and everything else that you have at the local level. And you might very well get back to the same index that we have been using for simplicity, the same global temperature, with very different local climates. So, I mean, in a global analysis, you might say, look, I canceled everything and I don't have climate change, but if you look at what matters for the impact, which is the local climates, including precipitation, it might be very, very different. And we had Pinatubo, the volcano eruption in '91, which did some of that by bringing a lot of particles in the stratosphere. And we could tell that it brought back temperature down a little, but also changed a lot of precipitation patterns. So I think geoengineering like this must be assessed with a much more sophisticated index, looking at local climates, including precipitation, and looking only at global temperature might make it look like a good idea, but I'm very skeptical.
So this institutional question is a really serious question. I mean, there was an IGBP workshop looking primarily at a research agenda for global engineering, but we looked, which was led to a paper, and we looked very hard at this institutional question. And we started sort of around the table trying to think of institutions that we knew about that even approached the lifespan of the kind of intervention that would be required to manage geoengineering, which is essentially a permanent commitment. I mean, the U.S. hasn't even been a country for 300 years. Germany hasn't even been a country as a unified country for a little bit more than 100 years. France
is very old, though.
France is very old, but the only institution that we could think about that had spanned, I don't know, a couple of millennia is the Catholic Church, and there's been ups and downs, and so the notion that we actually know how to construct institutions that are robust enough to do this, essentially forever, is a highly uncertain proposition, I would say.
Those are really great comments, and I want to go back to your first point because it raised an issue we're not talking about today, but is equally important, of integrated decision making. And we are focused on the integrated modeling, but there's the decision makers are fractionated, if that's a word. You've got health, you've got ag, you've got people taking decisions without talking to each other, and you often have these decisions taken without people talking with those who have experience on the ground. And to find our science needs to move into an area where we are much more engaged with people who have the experience on the ground. That you can look at all the projections for what's going to happen for Boston with sea level rise, but you sure want to talk to the building managers because they can tell you what the problems are going to be. Our science can't, but they have the experience, and to find ways to move to much more integrated decision making so that we can really learn from everybody's areas of expertise. And we're getting down in time, but we have 3 questions, which is great, more engagement.
Thank you. Joyce Suji, exponent and member of the committee. I think we've heard a lot about all modeling is great, but what people really care about is what is happening locally, and what's happening locally is very dependent on local conditions. But I don't think that's a reason to just throw all the models out. I think the models, by incorporating a lot of complexity and trying to work together and producing more complexity that may be very confusing, but it gives you a lot of what-if scenarios that each person or each entity locally, be it a water provider, farmers, be it municipalities or utilities, each could then decide what of that is useful for me in my particular situation to try to prepare for what might change in the future, whether we agree on climate change or not. And so I think there's a lot of value in that, and I don't think we should get discouraged. And then my question was, to what extent are are some of these models and taking into account future changes in demographics? For example, in the United States, the population is graying. We're going to have more elderly people. People are living longer, not necessarily healthier. A lot of people haven't been able to save for their retirement. What will happen to them? How is the population changing geographically around the country? What's happening with immigration and the new immigrants that are coming in? Is any of this being considered, I guess?
Well, it's being considered, but not as much as it should, you know. So there's lots of estimates of population growth, but the key issues, if you look at something like heat stress and coastal flood risk, is where those people are. And we're doing I'm participating in the UK National Risk Assessment at the moment, which is it's a statutory obligation. It's part of our Climate Change Act. And the main problem, we've already hit the buffers because no one will stand up and talk about where the people will be because suddenly it's about planning in floodplains, right, which has political connotations. And, you know, so it's very difficult because, you know, especially in the near term, someone has to stand up and say there may be all these people here. And the other one is healthcare and healthier people. So we know there'll be a lot of older people, but will those older people be healthier, which is the sort of general trend, or will we reduce social protection measures, you know, under austerity, and so they'll not be healthier, they'll have chronic diseases and care. So those are two areas that actually do need a lot more research.
And that's true for much of the health modeling. A lot of the modeling, as you heard yesterday, is imposing future climates on today because it avoids this kind of question. And as Tony mentioned, it's health, it's all the sectors. The most common assumption is current vulnerability is going to stay the same, which is the least likely outcome. And it is an area where the models need to have a lot further development.
I'm Gary Girnar from Department of Energy, again.
Good.
By the way, I think this is really exciting, what we're talking about today, also yesterday. I wanted to make a comment which leads into a question, and that is that I represent a federal agency that supports climate modeling research. And the climate modeling community historically has been confined to just understanding the climate system. If you talk to DOE or NSF, NOAA, some of NASA, at least they're focused on providing grants or contracts to just understand the system. One thing which came out over the past few years is that when you start validating climate models, you go back in time, like 1970, initialize a model, run it forward, and you don't get the same answers unless you plug in volcanoes along the way, or big wildfires, or economic shocks. And once you plug in all that exogenous stuff, you can start to reproduce your observations, or at least corroborate them as much as you can. The one thing about the future is all these other exogenous things disappear. So we're making projections as if all of this other stuff doesn't really happen. And that's a weakness of a lot of these climate models, but we just try to do the best we can. We could actually improve it by doing probabilistic estimates of how many volcanoes might go off, and I think there are 3 to 5 a year around that have some impact regionally, but they're all important to some degree. The other thing about integrated assessments into the future, and we talk about 2020 or 2050 or 2100, very often we're frozen with today's technology. DOE puts a lot of money into what they call resilient infrastructure. So does Department of Homeland Security. And what they often say is they define an end state of, say, 2050 where they want no blackouts. What does it take for technology or innovation to assure that no blackouts will occur given the pressures that climate change is going to have on the exceedances that we see for today? So the climate community is thinking in systems of systems now. It's not just the climate system, it's a climate system which is part of a broader system, which is the energy system or water system, and now we're talking about the health system. So a question for you guys is if we think about what the desired end states would be for the health system, where climate is a component of that broader system. What is that desired end state, which isn't so far out that we don't have to imagine what the technology is going to be like in 2100, but it's a couple of decades out. Because that's really going to help the climate community organize itself around health as a major partner in this.
Great question.
So one suggestion to how the climate modeling community might think about that problem. Not saying this is the only way they could do it. Would be to go back to something, actually to go to something like the Millennium Development Goals, or what will emerge from the Sustainable Development Goals, that essentially have a whole set of internationally agreed targets, many of them having to do with health status and poverty reduction, and then structure a series of experiments that could begin to address whether or not the kinds of variability we see in the climate system makes those easier or harder to achieve. I'm not saying it would be easy to do that, but that at least the scientists don't then have to go back and sort of invent a bunch of goals for themselves. And, they can rely on an external process, a very complicated and long and arduous process for arriving at those goals. But they could contribute something useful to assessing the difficulty of achieving them or not.
More so than the actual health status that will be anticipated in the future, I think that the question is, what kind of desired health system do we anticipate in the future? And from a European perspective, it will be universal healthcare, right? I mean, that's what we aspire to in the European Union, because we do believe that if everybody's access to healthcare, the cost will go down because, you take care of people as early as you can, and you're able to prevent those future expenditures in the healthcare system. However, that concept now has been undermined with the economic crisis, as you know, because funding has decreased in the health sector, and there has been a lot of migration that has caused a lot of issues. So ideally, we would like to see universal healthcare as the end goal of the healthcare system from a financial perspective, not only from a human perspective, but also from a financial perspective, but it doesn't look like that. So if we want to come up with a vision of an end state of the healthcare system, we'll have to incorporate those economic projections also, because they will factor into the outcome of that healthcare system.
Another answer to that is part of the development of the new scenarios. There are emission pathways, the RCPs, but there's also socioeconomic development pathways, the SSPs. And one of the SSPs is an optimistic, aiming for sustainable development. And there's some nascent work on what those would mean. So in an optimistic world, what would it mean for the health sector? And we can talk a little bit more about that. But there's been a little bit of thinking that has gone into it using that particular framing, which may be useful for the models. And Stephane, did you want to add something? Yeah.
Just very briefly on the technology option. So a lot of what we do now will depend a lot on what's happening on the technology front later. And even when we discuss the short-term mitigation efforts today, it depends so much on how much negative emissions we can achieve after 2050. And who knows about that? It depends on technologies, acceptability issues, and many other things. And I think that's where the modeling you do and the information you provide depends completely on the question you ask and the decision-making framework you're working with. You probably don't want to neglect completely the possibility of technology change and to have like this great development that help you reach your goals. But if you take like a sort of like risk management perspective, you surely don't want to assume from the start that you'll have the same type of technology development we had in the past, or even better. So I think answering the question, you can't do it looking at the model and the information provision. It completely depends on how this information is used, and I think as we work on the provision of information, we have to work at the same time on how to use this information in a way that's consistent with what this information is. And I think, for instance, in the climate domain, because the model outputs look so much like observations from the past, a lot of people were using them exactly like if they were observations of the past. And it's probably something that all sectors, including health, will meet in the future. So it really we need a lot of back and forth with decision makers and users of this information to make sure we don't mislead them by doing projections for the future that look a little bit too much like observations for the past.
And we're just only slightly over time, so Linda, why don't you ask your question, and then we'll take our break.
Linda Wennerberg from NASA. I'm going to take a shot at being slightly provocative. The provocative statement is the fact that the assumptions I'm hearing, where there's a tremendous amount of debate over the actual ability to project and make decisions, I'm hearing from a lot of the panelists the issue that if you have resources, you're much better, you're going to be able to manage this versus if you don't. If you look at civilizations over the years, environment, small e, the things that go wrong build up, build up, build up, and are tremendous amounts of impacts throughout a social structure, and things go to nascent. They change. They fail. So that's the provocative statement, is that perhaps those resources are not going to be as helpful as we think. They may be in the very short term, what we see now. You can respond to a Hurricane Sandy if you get, or Superstorm Sandy, if you get 4 of them, you just are going to run out of resources sooner or later, and you're not going to be the wealthy country. You're going to be the country that's just as strapped as everybody else, with a lot more people and a lot more expectations. So that was just an observation. The one thing I'm hearing, and you folks actually touched on it very well in this last discussion, was the fact that I think that there's a tremendous amount of communication that needs to occur between the modelers that are very familiar with modeling human health in the issue of climate change systems. I think in other words, somewhere there's a lot of needs to be a better understanding, and many of the panelists really probably understand it, but a lot of the folks don't. What is it? What are the fundamental questions you can't answer? What are your goals? What are you looking for when you're trying to do human health modeling and trying to predict what's going to happen in a system for people? And then also take in a series of very complex other systems, both natural and infrastructure related, and putting them together. And so I think the panelists actually really see that, but I think often what happens is the fact is that it's very difficult to get the practitioners who really do the human health modeling, the issue about dealing with infrastructure, dealing with hospitals. That was a great discussion yesterday, because we're all thinking, we didn't think of that. And so I'm asking folks to think about what would be a great way to kind of recalibrate and get the real questions that we know our modeling can answer or would normally focus to answer integrated in this area.
Good question.
So the way I would think about that is, where would I write, to whom would I write the proposal? Right, a very operational question. Mm-hmm. To whom would I write the proposal to get real collaborative research funded, so you could actually have that have the support to have that discussion amongst communities? Mm-hmm. And right now, I don't know the answer to that. NASA and NOAA ran a small program a few years ago. It's gone. That's
And
pretty much it.
There are individuals that are doing it. The panel
Lots
is a
of
great
individuals
example,
who've made heroic efforts with hardly any support, and outside of whatever base research support. So this question is, I think, actually quite similar to lots of questions about inherently interdisciplinary research, where at a very operational level, the response back to the agencies and institutions that support research is, we would like to do this. Tell us where to write the proposal.
Yeah.
If you can't answer that question, it ain't going to happen.
Yeah.
It's pretty clear.
I totally agree with that. Getting interdisciplinary research funded is very difficult, and the funders are just not good at it. They always, certainly from the UK example, they have the odd pilot study, but it's never sustained. You know, they just keep reinventing the wheel and going back and back. There's also an issue about kind of health decision makers and not understanding climate change. So, you know, there's kind of this huge education issue there, because we've been trying to do some modelling on extreme events, you know, Sandy type like event for the UK, and we went and asked several public health policy people about what information they would like, and they both came back and said, I don't understand why you're doing this, you know, go and do something else. So, yeah.
Well, it's the reason why I say it is that practitioners or the researchers in the area of public health or human health may have not been well integrated into the other climate. This is what's happening with the climate. And then you're saying, okay, somehow they have to match. And I'm hearing heroic efforts from people on the panel and elsewhere in the room. But some of it is the question of how can we better define what those things can do, and also how can they possibly work together so we can get something that get traction on the interdisciplinary.
Can I just say, on a positive aspect, there's a huge amount of interest on sustainable development within public health in the UK and within Europe. There's a lot of stuff going on. You know, a lot of support within the public health community that doctors recognise this is something they should, the health of future population is something they should be caring about. But the operationalisation of sustainability is still where we're trying to get to.
I was in the academia in France, and I would have said that positions and training were very big obstacles. In fact, it's much more difficult to be supported by anybody if you're just in between two groups, and that really doesn't help to find the long-term position, so it's not creating a lot of incentives. And in terms of training, my feeling, so I don't know how much it's valid here, but that we're training people to do interdisciplinary work in a way too early. So we have people who know like a little bit of everything, but if you really want to do the innovative research, it might not be enough in each domain. And when people have been really trained in one domain, at the time you want them to expand and to look somewhere else, that's where all the incentives are going against it, because that's when they need to just publish in one domain to make a reputation and have enough paper to get a position. So I really feel that the good moment for people to move into interdisciplinary is when they have a very solid basis in one discipline, and that's really when they can't.
I did an interdisciplinary PhD, and the joke was all the faculty were in their silos, and our job was to do the integrating. And that was what the comps were about, and we used to joke they read them so they would find out what they were supposed to be doing, because we actually had to do that. But that was the question, is that I feel like everybody has got great skill bases, and I'm hearing them, and I'm literally trying to go, what is the fundamental issue that we communicate on, that we can link up more easily? And a lot of you folks do it, but that is a question in the larger world when folks are coming back and saying, it's a component of it, but they don't understand what each other is talking about. So.
It's a really good question. I think this is what we're going to talk about in the closing panel. And how long do we have for the break? We have 15 minutes. I don't wear a watch, so look at yours and decide when 15 minutes are over, and we'll see you then. And thank you very much to the panel. You did a great job.